All right, welcome back. Total DPT, another anatomy breakdown, muscle by muscle. Today we're diving into a muscle that doesn't really get any love, the subclavius. Not flashy, not often mentioned. Honestly, most people probably forget it even exists. But the subclavius is a sneaky important muscle, especially when we're talking about clavicular control, AC joint mechanics, SC joint mechanics, shoulder mobility, neuro symptoms in the shoulder trauma. So could be touching a lot of things for sure. So let's break it down. The subclavius originates from the junction of the first rib and its costal cartilage, anchoring at the top of that thoracic rib cage. From there, the muscle travels laterally and slightly upward to insert onto the inferior surface of the middle third of the clavicle. Its small cylindrical structure allows it to act almost like a dynamic ligament, pulling the clavicle downward and medially toward the rib cage. This positioning gives it a stabilizing role during movement of the clavicle and upper extremity. Also against compressive forces through the shoulder girdle, so think pushing, bracing, or absorbing impact during a fall. That's when it really has to do that stabilizing action. Not a powerhouse muscle by any means, but its anatomical location makes it uniquely positioned to influence both the mechanics of the clavicle and to protect the structures lying deep to it, including the Subclavian vessels and also the nerves of the brachial plexus. So just to reiterate, the origin of the subclavius is that first rib and its costal cartilage. The insertion of subclavius is going to be the inferior surface of the middle third of the clavicle. As we mentioned, when the subclavius contracts, it'll pull the clavicle down and towards the rib cage. That doesn't sound like much, but that action helps stabilize the clavicle during upper limb movements, especially when force is being transferred to the arm. So thinking again, falling on that arm or pushing. Some sources also argue it plays a small role in limiting excessive clavicular elevation or protecting against SC joint dislocation. That's pretty rare, but definitely a serious injury. So to summarize, the subclavius is responsible for anchoring and stabilizing the clavicle, stabilizing the SC joint, depressing the clavicle, and also protecting the subclavian vessels and brachial plexus underneath in the event of trauma. Subclavius is innervated by a nerve that's literally called nerve to subclavius. So that's one you should never forget. Nerve to subclavius typically arises from the upper trunk of the brachial plexus, carrying fibers from the spinal nerve roots of C5 and C6. It's a nice, cool one where the name is the function. Nerve to subclavius literally innervates the subclavius. Subclavius is innervated by nerve to subclavius, roots C5 and C6. In cases of clavicular fracture, especially from direct impact or seatbelt injuries, the subclavius can help prevent life-threatening vascular compromise. Just having that cushion, that shock absorber there goes a long way. It's a multifaceted helper when it comes to that shoulder health and mobility. A small muscle with a big role, but small changes in its structure might lead to pathology. We've got the Subclavius Posticus, which is a rare muscular anomaly where an accessory muscle runs from that first rib and inserts onto the superior border of the scapula or coracoid process, passing over or near the brachial plexus and those subclavian vessels. Multiple studies have shown that this accessory muscle can be a direct source of thoracic outlet syndrome, particularly the neurogenic and vascular types. Patients with Subclavius Posticus may present with upper extremity numbness, diminished pulses, paresthesias or tingling, and also weakness, especially in positions involving clavicular depression or arm elevation or shoulder elevation. We've got a 2023 study from Clinical Anatomy in which Subclavius Posticus was noted in approximately 8% of cadaveric samples, highlighting that while uncommon, it's far from irrelevant. Another study in the International Journal of Morphology emphasized the potential for this variant to compress the lower trunk of the brachial plexus, so mimicking that thoracic outlet syndrome for sure. In fairness, due to its location and orientation, even an anatomically unremarkable subclavius could contribute to or be involved in that thoracic outlet syndrome pathology. While the normal subclavius provides passive stability and protection, it can be a hidden source of some significant dysfunction. So that's just a reminder that even the smallest, most obscure muscles can have a huge clinical impact when that anatomy deviates from the norm. From a clinical standpoint, recognizing this possibility is very critical, especially in those young, otherwise healthy individuals present with those thoracic outlet-like symptoms. You do wonder if the subclavius is involved. So definitely keep that in mind. From a rehab standpoint, you're not doing any exercise to get the muscle going, but might be worth consideration for manual techniques, clavicular mobs, or even trigger point type programs. So that's subclavius. Not a big boy, not going to show up in your pump. Might not be mentioned in your class. Not very likely to have a patient referred to you with any subclavius pathology. But clinically, it does matter. Definitely something to consider for sure. It's that kind of attention to detail that sets apart a good therapist from a great therapist. If you're a fan of the breakdowns, like, comment, subscribe. Next up, we've got pec major. And then after that, we're going to hit pec minor. Thanks for watching. Treadwell DPT. Catch you next time.